Welcome to Trust Talks with BBB Serving CT. I'm Kristen Johnson. In business, trust talks, and Better Business Bureau's mission is to enhance marketplace trust. In each one of our episodes, we hope to give you a better idea of what to look for, what to look out for, and what to expect so you can spend your money wisely and avoid being scammed. Millions of Americans rely on Medicare Advantage plans for their health coverage. And in recent years, some of those plans have offered extra help for things like food, housing, and transportation. But big changes are on the way. We're breaking down what this means for people who depend on those extra benefits, who's affected, and how to prepare for the changes ahead. Here to explain it all for us today is Tracy O'Brien. She's a licensed insurance agent and the owner of Senior Insurance Consultants in Orange. Tracy, thanks so much for being here with us today.
Thanks for having me.
This is a very difficult topic. It's kind of confusing, but you're gonna explain it to us.
Absolutely.
Simplify it for all of our viewers out there. But first of all, tell us a little bit about your business.
Sure. So my husband and I own the agency together. We started it in 2017, and we've been in the insurance space really since 2010 when the first baby boomer turned 65. So since then we've grown to over 60 agents here in Connecticut, expanded to 32 states with 90 agents altogether.
Wow.
And our specialty is Medicare, but we also help with ACA, which is otherwise known as Obamacare. We help with life insurance, financial products, all different kinds of things, whatever falls under the life and health umbrella.
So not just seniors, but primarily you work with seniors?
Primarily.
Okay.
But sometimes seniors want to retire and they have a younger spouse. So that's what brought us into the Access Health world.
Okay. What are dual eligible Medicare beneficiaries? What is changing for them and why?
Yeah, so there's a lot of moving parts to that question. So a dual eligible typically is someone who qualifies for both Medicare and some level of extra help from the state. So they could have what's called QMB, be a qualified Medicare beneficiary under the Medicare Savings Program, or they could be what we call a full benefit dual eligible, where they're getting full Medicaid from the state. So there's two different levels really that the dual special needs plans are broken out by. But what these plans are designed to do is give dual eligible seniors or Medicare beneficiaries all the benefits of original Medicare and then some. So they may get extra, a higher level of dental coverage, higher glasses coverage, maybe medical transportation, personal emergency response systems, the I've fallen and I can't get up button. But the big change for the duals for 2026 is that we've had this VBID, value-based insurance design, for years, where they get this over-the-counter benefit monthly that they can use for over-the-counter items like toothpaste and Band-Aids and Tylenol, or healthy groceries. Some of the plan designs, they were able to pay their utilities or their rent. So now it's changing to this SSBCI model, which means that they have to have some type of chronic condition in order to be able to use those extra benefits for the groceries, the utilities, and rent, and things like that. So they've been able to get their prescriptions at no cost for a lot of years, and now some of them are going to have little copays going forward.
Is anything replacing those benefits, or is it really just out of pocket now?
Yeah, it's just out of pocket. There's, we've seen a big reduction in these benefits for 2026. And, it's really kind of come as a shock to a lot of the beneficiaries because they rely on these benefits a lot, probably too much because, at the end of the day, it's health insurance, but there's been some dramatic cuts and they're really impacted.
And have they had much time to prepare for this?
Not really. So with marketing rules for Medicare, they'll get their annual notice of changes right at October 1st. So it's really when they're reading that, if they read it, that they're seeing, oh, wow, I had this in 2025 and it's going to be this in 2026. And it's really shocking to some of them.
So what happens on January 2nd when they go to pick up their prescriptions?
They may have small copays, the duals who, for years and years and years, with the VBID model, they've had $0 copays. So now they'll pay $5.10 or $12.65. So that's why it's really important that they review and they look at their medications, over the year, 90-day supplies, preferred pharmacies, mail order, things like that, because they can possibly save money making little changes like that.
And that's where someone like you would come in and you'd kind of go over all of that and help them through it. The Medicare Advantage model is changing as well. Can you explain that?
So that's really the VBID to the SSBCI.
Okay.
So there's no real change to the actual Medicare Advantage model. We're seeing a decrease in PPO plans available in the non-dual space especially. So it looks like a little trend back towards the HMO.
Okay. Was that before the Affordable Care Act?
There's always been HMOs, but people like the freedom they get with the PPO. So typically, you don't have to choose a primary care. Everything doesn't have to go back through your primary doctor. You don't necessarily need a referral to see a specialist. You can have out-of-network coverage, so if, 8 of your 9 doctors are in network and 1 is out, maybe they'll see you out of network for an additional cost. So people are a little nervous about HMOs. I think in Connecticut, we're a small state and most of the carriers have really strong networks in their HMO network, just because if they don't, they lose huge market share. So in Connecticut, don't be afraid.
It might be more insulated from that change.
Exactly. Yeah. And, and that's all part of the review process as well. Just like with the prescriptions, let's take a look at the doctors as well.
You mentioned chronic illness requirement. Can you kind of go a little bit more into that and what the requirement is?
Yeah. So with the dual special needs people, their monthly benefit of over-the-counter, let's just say it's $50. So they get $50 every single month and they can choose how to spend that. They can buy toothpaste and Band-Aids, they can buy healthy groceries, they can use it towards their utilities, towards their rent. But now with the SSBCI model, they must have a chronic condition. And there's a list, and it varies a little bit by carrier, but if somebody has major mental illness or even asthma, autoimmune illnesses, they're being treated for cancer. The list is long. Okay. I would say that 9 out of 10 will qualify for the SSBCI.
Okay, so I was going to ask about cancer, so that would be considered a chronic illness, and it wouldn't really change for you then.
Correct.
Is there additional paperwork you have to fill out to show that you have that chronic illness now?
Maybe.
Okay.
So, for example, if somebody's in a dual special needs plan now and they automatically renew for next year, the carrier will have the claims data. So they will automatically give them those benefits. But if somebody decides to change and they have no claims data with that carrier, we need to get information to the carrier either through their primary care doctor, whoever's diagnosed them with this, just to give their blessing to say, yep, they've got this.
Okay. And you kind of mentioned this before. How do you know if your benefits are changing? You said you'll get something in the mail.
Yeah, every year the insurance company must send, it's called the ANOC. We have a lot of acronyms in Medicare, the annual notice of changes. So, it tells them if they're getting a premium, it tells them if a copay is going up. It only shows them the changes for next year. So, if their over-the-counter benefit is being reduced, if their dental is being reduced. So all the information is in the ANOC, and people get it, and some people use it for kindling and don't ever look at it, but it's an important piece of paper to look at.
These changes were made by the federal government, correct?
These changes are by the carriers.
Oh, okay.
Some of the changes that they've had to make is because of some of the things from the federal government.
Oh.
But for the most part, the carriers, they're the ones that create the plan designs. They put the bids into CMS for approval, and then they roll out the plans to the public.
I see. Were there any additional changes coming out of the state legislature here in Connecticut to help residents here?
So nothing really out of the state. Okay. We're always in conversations. But really, one of the biggest impacts was the Inflation Reduction Act. And what they did last year for 2025 is they capped prescription drug expenditures for seniors, the non-duals, people who don't get the extra help from the state, that they would spend no more than $2,000. So, in past years, people would have their deductible, they'd have their copays, they'd have the donut hole, they'd have the catastrophic coverage. So this could go on to, and they could spend thousands and thousands of dollars. So with the Inflation Reduction Act, it changed. So now the most they'll spend in a given year is $2,000. 2026, it'll be $2,100. But what happened is the insurance companies had to adjust benefits because now they're absorbing a lot of the cost of those prescriptions.
And those are very pricey, aren't they? Especially for those with some of these chronic illnesses like cancer.
Yep.
Speaking of drug prices, I know we've heard a lot in the news about lowering drug prices. Can we expect to see premiums for prescription drug plans to go down next year? Of course not.
No, so that was also part of with the Inflation Reduction Act that, the carriers had to really scramble and figure out how they're going to make up for this cap on the actual prescription. So we saw prescription drug costs just go crazy. The deductible in 2026 is $615. Most people have to pay that first before their copays kick in. So so they were going to be really high, and then the government did step in and say, no, we're going to make adjustments for that. So they did come down a little bit, but we see premiums anywhere from around $8 all the way up to, in the hundreds.
It sounds like a majority of these changes will have an impact on people's budgets.
Oh, absolutely.
And doesn't sound like there's really any relief in sight.
So yes and no. So if somebody has, when we review their drug plan and their drug costs are $2,100 next year, they can set up what's called the Medicare prescription payment plan with their carrier. So essentially what they do is they call up whoever their private insurance is, and they can spread that $2,100 out over 12 months next year. So instead of, they're at the pharmacy on January 2nd and they're like, yeah, it'll be $2,100, they can spread that out. So that is one of the really good things about that Inflation Reduction Act.
What other tips do you have for Medicare beneficiaries?
Don't take no for an answer. Just because your prescription is this much money through the insurance, it doesn't mean you can't go to the Canadian pharmacy. You can do that. One that we work with is actually in Florida. So it's, I know people are worried about tariffs and things like that, but they're right out of Florida. You don't have to go through the insurance. You can use a coupon like GoodRx or something like that. You don't have to follow all the rules of your private insurance.
Any other tips, not just drug related, but in regard to all of these changes?
Definitely make sure, number one, that you will have a plan on January 1st. So there's been a lot of plan terminations. Nationally, there's about 2.1 million people have had their plans terminated where they're back having to shop. Here in Connecticut, we're 60,000 of that. So just make sure your plan is good and in effect for January 1st. And if you're not sure, just call your carrier, and the systems should tell you, you should get a letter. And we know that these letters sometimes go unread. So just confirm.
Okay. Tracy, on the show, we often talk about scams. And I know there are scams that surround Medicare. In fact, BBB Scam Tracker frequently receives reports of scam calls and texts pretending to be from Medicare. In one report, the target said that a caller pretended to be an agent asking if I got a new updated Medicare card in the mail. He then verified my name and mailing address. Then he wanted me to get my old card and read it off to him, such as the date on the lower right side of the card. Another consumer warned about text messages that they'll say your health benefits are about to expire. You need to call this number to renew. And then the representative will tell you you have to pay, and then your bank has to verify it. So oftentimes callers will allege that they can enroll you in a better plan, but to do so, they want your personal information. They need your social security number, your Medicare ID number, things that you would often need that would be associated with signing up for health insurance, right? But in this case, it's not them. It's not Medicare because they're probably not going to call you out of the blue,
Medicare
right?
is not going to call you unless you've scheduled an appointment. IRS is not going to call. Social Security is not going to call unless you've scheduled a call back. So oftentimes, they're targeting our most vulnerable population. But I will tell you, they don't even need to give that information to get their plan changed. So last year, my mother's plan got changed. She called me and she said, "Hey, I just hung up from Justin. He said he was working with you and he wanted me to have a better plan." So my mother, God bless her, changed her plan. But I know she doesn't have her Medicare card with her. She doesn't know who her 12 doctors are or her 15 medications. So how she got changed, we could never even solve the mystery. So my word of caution is, if you don't know who's calling you, don't answer. And if you get a text message and it sounds too good to be true, it probably is. So, there's a lot of really bad actors out there that, will switch anybody, and it's for their benefit, not for the beneficiary.
How does it benefit them to have your Medicare ID number? I get Social Security number. That's the kind of fraud where they're actually trying to steal your identity. What are they trying to do with your Medicare ID number?
Probably change your insurance plan and get paid commission on it.
Oh, and the insurance plan, so it will be a real insurance plan with maybe a not so great company?
Not even necessarily not a great company. I mean, they're all good companies, but it just might not be the best plan for you. So like with my mom, the plan that she got switched to, it's a great plan if you don't need dental. So, my mom needs dental. So, fortunately, I was able to switch her back. And we do this. We get on the phone with Medicare, with our clients and facilitate three-way calls so that they can, have the plan, retracted and put back into the plan that they were meant to be in, and then file a marketing misrepresentation. So, that's the best thing they can do, is just call and complain and make the marketing misrepresentation claim.
I imagine Medicare has a team that works on scams like this because they happen on a daily basis. They need people to process this.
Yep.
I'm amazed that they were able to connect you to your mother as well. Like the person on the phone, Justin, knew what you did for a living.
Yeah. So what happens is, and we see it, they'll go through senior housing and people will be like, no, I work with Tracy. So they tell them, and then they just flip it around. Oh yeah, Tracy asked me to come. Tracy told me to call you. Tracy's not having somebody else call her mom. So they're really, really sneaky.
Wow. We have gotten reports of people going door to door too to do this.
Illegal.
It's illegal.
It's illegal. So they'll go under false pretenses, but it is illegal to door knock. So, and we hear about it all the time. They'll go to the large low-income housing and they'll get in on an appointment with one person, and then they'll just door knock the rest of the building to try to get in. You can't do that.
How big of a headache was it for you to reverse your mom's plan?
Not a huge headache, more heartbreak. So, it happened to her, and we could never figure out who the broker was. Like even with my resources at the carrier, we were just never able to identify who it was to, get them terminated.
And to think of all those seniors out there that don't have a daughter who works in this field or someone looking after them.
Yeah.
And get taken advantage of.
Yep. And that's the thing, like I've really, throughout the years, my demographic has changed a lot where I'm working with, I say kids like me, people who have children, and then they have the senior parents because, we fight for our parents like tooth and nail. So I love working with the kids of the seniors.
Well, we have some tips from BBB. You've mentioned a few of them, but we want to go over this. And if you have anything to add, please interrupt.
Sure.
But the first one is beware of anyone who contacts you out of the blue. We always say it. If someone asks you for payment, it's a scam. You will need to contact them on your own. They will not call you first. Government agencies, whether it's the IRS, Medicare, they will not call you. They usually communicate through snail mail unless you've called them first and you've approved that line of communication.
And what I'll add to that is that the majority of Medicare Advantage plans have no premium. So if they're looking for some type of payment from you, that is malicious. Most of these plans you pay nothing for, especially the dual special needs people.
Okay, good tip. Be wary of free gifts and health screenings. Keep a healthy level of skepticism anytime a broker offers you free gifts or other special deals. Other times, brokers will offer free health screenings to weed out people who are less healthy. This technique is called cherry picking, and it's against Medicare rules.
It is against Medicare rules, even to the point of if we do like a senior health fair, we can have, booths and tables and vendors and everything like that. We can't even be next to somebody doing blood pressure screenings because it just looks like maybe, hey, their blood pressure's high. We can't talk to you. So no cherry picking. We can help everybody. And I wanted to circle back to the first part of that.
The free gifts?
The free gifts. We are allowed to give gifts of nominal value. So like a coffee mug would be okay. It has to be under $15.
Okay.
So, if they're offering really expensive things, $50 gift cards to switch your plan, they're not switching you for the right reason.
Mm-hmm. They're going to get that money another way. Mm-hmm. Okay. Never offer your Medicare ID number, your Social Security number, your health plan info, or banking information to anyone you don't know. I feel like a broken record because we say it all the time at BBB, but it's true.
Yeah. So one thing that I really like to do, we see a lot of people this time of year. We still see people in person at their home, but I'm doing a lot of Zooms. And I really like doing that because I can pull in the information. So when I'm doing like a Medigap plan, we do have to take money, but they can see that I'm in the carrier's application and they're watching me enter all their information. And then once I send it off, it's all gone from me. Okay. So if somebody really wants to talk to you, have them come to you, you go to them, or do it via Zoom so that you can see that they're like a real person.
Okay, good tip. And then go directly to official websites. If you want to make changes to your healthcare plan, go directly to Medicare.gov, healthcare.gov, or your employer's health insurance provider. Don't click on links in suspicious messages. Do some of your clients get those emails? Those fake emails?
All the time. Yep. And, Medicare.gov, I mean, that's our go-to resource. The Medicare and You book, that's our Medicare Bible. And we reference that all the time too. But what they don't necessarily do in those websites is really explain the nuances of one plan over another plan. And that's, you can get a good idea of where you want to be, but those little nuances, those are really best discussed with an expert.
With a professional.
Yeah.
Like yourself. We have a little bit of time. I want to talk about enhanced tax credits. What are those? Why are they changing? And
oh boy.
When are they changing?
So the enhanced tax credits, so that refers to the Affordable Care Act and Obamacare. So it's really for the people under 65. And it's not just Connecticut, it's a national thing. So the enhanced tax credits, people are getting bigger subsidies and tax credits towards their plan premiums, and those credits expire December 31st. So between the tax credits coming down and the premiums going up, there's going to be a whole lot of sticker shock starting on Saturday, because that's when Access Health opens.
Okay. And there's a subsidy cliff. Can you tell me what the subsidy cliff
that's
is?
the cliff. That's when the tax credits end.
So hourly workers, they might work overtime and not realize that they've reached the threshold until tax time comes around. And then they might owe more money than they thought they would.
Yep. Yeah. So it's really important, when if you're have a fixed salary, it's really kind of easy. But if you're a seasonal worker or a tipped worker, you get a lot of overtime, you get a bonus. It's so important that you report that in your Access Health or to your broker so that they can update it, because the last thing we want is for you to get that it's shocking enough with the premiums, and then you're expecting this big tax refund and something wasn't right, and you end up maybe not getting any money back or possibly owing money.
Mm-hmm. And for people that depend on that look forward to that may spend it before they have it, that's a problem. You know, we've talked a lot about money today. I want to spend a little bit of time talking about your nonprofit that you created. Tell me about it. What is it called?
It's called Senior Promises, and we grant wishes to underprivileged senior citizens here in Connecticut. So I get to do this. I get to do my day job with my husband, and I get to do my nonprofit with my best friend. We met when our daughters were in 3rd grade, so it's been a minute. And you know, it's not like make a wish. It's not dying wishes. It's living wishes. So you know, they're not expensive wishes, but they're meaningful to the many people that we've granted them for.
Can you give me a couple examples?
Yeah. So some of the fun ones, we did a pair of cowboy boots to a gentleman. He was 90 years old. He wanted a pair of cowboy boots his entire life. So we surprised him right at Christmas at his senior center because they nominated him. So he put those on and he started belting out his favorite country song. And we did a gentleman, he wanted to play golf. He couldn't afford golf. So we got him a round of golf. And we flew a woman to Washington, D.C. She hadn't seen her sister in 10 years.
Oh.
Yeah, so things like that. And then, you know, sometimes they're practical but heartwarming. So we had a woman who had lost a lot of weight because she had had cancer. So none of her undergarments fit her anymore. So my daughter took her to TJ Maxx or Marshall's, and, you know, they just filled up bags with stuff for her so that she could just be comfortable.
I'm sure you get more than you get out of it, like they always say. I mean, these are all heartwarming stories.
Oh, yeah. Yep. And we're, you know, Christine and I really do most of the wishes on our own. You know, it could be, I mean, we've delivered wheelchairs and TVs to community centers. One of my favorite ones, though, was Manchester Housing. We helped them with their community garden. So, you know, one little wish and, you know, but it serves hundreds.
Right. And continues to serve year after year. So how can people find out more about your nonprofit?
Seniorpromises.org, and you can go to the website, you can apply for a wish, you can donate, all that stuff can happen there. And we're always looking for volunteers.
Wonderful. Well, Senior Insurance Consultants has been accredited with BBB for nearly 4 years. What do you hope that accreditation says to your clients?
That, you know, that we do the right thing for our clients, and, you know, we get communications from you guys all the time, making sure everything's right with everything that we're promoting, our contact information, all that stuff, because you protect them, the consumers. So, you know, so being part of this and knowing that, you know, you have their back too, because we're Better Business Bureau members. I think that's a great thing. And, you know, we're happy to be members.
Well, you've certainly disseminated a lot of information for us today, but you've done it in a way that's understandable, and I really appreciate that, Tracy.
Medicare is complicated, and we make it simple.
Tracy, thank you so much for being with us today.
Thanks for
having me. We appreciate it. And thank you for joining us. We'll see you next time.
Nick Augustino right here at the East Side Restaurant. We always have the complete full dinner menu. Knockwurst, bratwurst, sauerbraten, potato pancakes, red cabbage, rice pudding, cream pies, all the desserts that Germany had to offer. I always do something different. Yes, I do. I brought seafood to the beer garden at the East Side Restaurant. East Side Restaurant, your German destination restaurant in Connecticut. Tiki-taka, hoy, hoy, hoy!